Okay, so we're going to move on to osteoporosis on the next slide. But let's just look at these different postures. So whenever we're doing a physical assessment of the musculoskeletal system, it's always important to see someone's posture, right? So kyphosis is that rounded thoracic spine, and it's from compression fractures of the thoracic vertebra, right? Typically from osteoporosis, and you get that humpback appearance because the compression fractures are causing not only a reduction in height of the person, but they're causing that rounded appearance of the back. That's called kyphosis. Okay, so thoracic kyphosis. Lordosis is that curvature at the lower part, and it's normal to have some lordosis of your lower back. Okay, that person in the middle has a good posture. Okay, some people can have really significant lordosis, but it's normal to have some lordosis in the lower back. And lastly, scoliosis, where the spine is not perfectly straight. And looking at this image on the right, C, you can see that there's curvature of the back. So there's lateral curvature of the back, and we call that scoliosis. And often, if we're not really sure if someone has scoliosis, we'll just ask them to bend forward. And that really shows the curvature of the spine. So sometimes when they're standing straight, it's hard to tell. This one's not. But then when they lean forward to touch their toes, it really stands out. Okay, so looking at the posture, seeing how they walk really helps. So if they have a knee issue or a hip issue or a back issue, looking at their gait will definitely help. Range of motion of all the joints, so the hip joint, the knee joint, the ankle, okay. Muscle strength and the size of the muscle groups. So just looking at, say, their thighs, do they have any atrophy of the muscles? Do they have any atrophy of the calf muscles? So just getting, and you always have another leg to compare to, or usually you do, right? So we're looking for symmetry. So range of motion, do they have equal range of motion on each side? Do they have equal muscle um, muscle size on each side of their limbs? Neurovascular status, of course, is always important. Checking the pulses of the lower leg, checking for sensation and muscular strength. So that's the neurovascular status. Okay. Okay, so let's talk about osteoporosis, which really is thinning of bones and low density bones, right? So they just don't have as much calcium and phosphate um, in the bony structure anymore. Okay, and that results in a low bone density. So typically, our bone mass starts to decline in our 30s. Okay, so the osteoclasts that break down the bone exceed the production of bone, which is done by the osteoblasts. So over time, the bone is just getting thinner and thinner and thinner. Okay, and that's why it's important to try and prevent osteoporosis starting at an earlier age, in your 30s and 40s. Because as you'll see, the treatment once you have osteoporosis is really just treatment. It doesn't reverse the bones back to normal. Okay? There's definitely risk factors for osteoporosis. One of the prime ones, or one of the main ones, is postmenopausal women because of that lack of estrogen. Okay? So in terms of health promotion, maintaining or consuming proper amounts of calcium and vitamin D is really important younger in adulthood to maintain bone density. Now, if you look, there's not a lot of foods that are high in vitamin D. Now, milk is fortified, so that tends to have a lot of vitamin D. So cheeses, milk, dairy products. There's cereals that have vitamin D added to it. Some fish, eggs, they all have vitamin D. Okay, but there's not a lot. And don't forget, you get vitamin D from sun exposure to your skin as well. The skin synthesizes an inactive form of vitamin D, which is then activated in the kidneys. Foods rich in calcium are important. So again, milk products, leafy vegetables, orange juice, they often add calcium to it, and also cereals. Okay. So remember to spend some time outside, and that is why often in colder climates, northern climates, osteoporosis is even more common, because a good segment of the population is vitamin D deficient. And without vitamin D, you can't absorb calcium from the gastrointestinal tract. So weight-bearing exercises, really important to prevent osteoporosis, right? So if you're using your bones, they don't tend to break down as quickly. So walking, some degree of weightlifting, but even just simply walking maintains proper bone health. So when we're doing an assessment on someone with osteoporosis, meaning low bone density. So remember, osteopenia means on bone density test, you have a thinning of the bones, but it's not quite enough to call it osteoporosis. So we'll call it osteopenia. Okay. So what are some findings of osteoporosis? Well, reduced height. Okay, that's from the vertebral compression fractures that occur, and from kyphosis. People lose their original height. Back pain, right? So acute back pain. Some people with severe osteoporosis, just bending over and getting back up can lead to a compression fracture because the bones are so incredibly thin. A history of fractures, in particular compression fractures of the vertebral spine, wrist fractures, hip fractures, those are all indicators that this person might have osteoporosis. Kyphosis we spoke about, that humpback or that rounding of the thoracic spine. And then of course, pain upon palpation of the spine would be an indication that there's something going on with the bones. Okay. On the right, just giving you an image of what normal bone mineralization would look like. And then osteopenia is just thinning of the bone, but not osteoporosis yet. And then osteoporosis, you can see that there's definite loss of calcium phosphate and then severe osteoporosis. Look at the huge gaps. So there's much more marrow, but the calcium phosphate part of the bone is vastly diminished. Okay, so let's just look at diagnostics first, and then we'll look at the fracture risk tool. So what about labs? So just because you have osteoporosis doesn't mean you're going to have an abnormal calcium level in your blood. Now, you might be vitamin D deficient because you're not getting proper amounts of vitamin D, or you're not in the sunlight very often, so you're not producing vitamin D. But calcium and phosphorus levels don't really translate into the person having osteoporosis. Alkaline phosphatase is just an enzyme that's made in the liver, and also it's made in the bones. So if you have an elevated alkaline phosphatase, you can have it in the setting of liver failure, or you can have it in the setting of some kind of bony disease. Okay? The imaging is the most important. Now, x-rays are not very sensitive for osteoporosis, By the time we're seeing osteoporosis on an x-ray, you have significant thinning of your bones. Okay, so it's not we don't use that as a screening tool for osteoporosis. We use a bone density scan or a DEXA scan. And that really shows how dense or how thin or osteoporotic the bones really are. Now, so the DEXA scan can be used, and now what's being used is ultrasound as well. So an ultrasound can be applied to the heel or the tibia or the patella, and that can also give us an indication of how dense the bones are. Okay, so a DEXA scan, and now a quantitative ultrasound can also be used. Okay, CAT scans aren't used typically for bone density. There's quite a bit of radiation to it, and we don't really follow osteoporosis with CAT scans very often. Okay, so let's look at the fracture risk. Okay, and these are important to know because osteoporosis is a common condition. Okay, so the first risk is age. So definitely as we age, remember, we're losing more bone than we're producing after the age of 30. So age is definitely a risk factor for osteoporosis. Gender, much higher in females, especially postmenopausal females, right? That's where women lose a lot of density of their bones because of the lack of estrogen. Someone who has a low body mass index, so they already have a very light frame, especially a female with a light frame, okay? History of previous fractures is in itself a risk factor for having osteoporosis. A parent, so typically a mother with a history of hip fractures or a history of osteoporosis. A smoker, so what does smoking do? It reduces oxygenation of bones, and just like other parts of the body as well, and that leads to poor bone development and lower density bones. So smokers are at risk for osteoporosis. Current use of corticosteroids, definitely. If you're on corticosteroids long term, you really need to be on calcium and vitamin D and even some of the medications we use for osteoporosis to try and prevent osteoporosis from developing. So taking corticosteroids is definitely a risk factor for osteoporosis. History of rheumatoid arthritis. So that would be a risk factor. I would say the biggest risk factor with that history is that you're typically taking corticosteroids sometimes to treat the underlying rheumatoid arthritis. By the way, coffee intake is a risk factor for osteoporosis. Okay. What else? Alcohol. So alcohol intake can also impair bone development and lead to osteoporosis. What about secondary causes? So say you have type 1 diabetes, that's a risk factor for osteoporosis. Osteogenesis imperfecta is a bone condition where the bones don't form normally, so that's definitely a risk factor. I mentioned the fact that if you have hyperthyroidism or you're taking levothyroxine for a low thyroid condition, but you're taking too much of it, over time, that's going to thin your bones. So don't forget, hyperthyroidism or taking too much thyroid hormone can lead to osteoporosis. Premature menopause, or you had your ovaries removed because of some condition, well, that can, now you're not making estrogen, that can lead to osteoporosis, okay? Chronic malnutrition or malabsorption syndromes such as celiac disease, lactose intolerance, any of those can also lead to poor absorption of calcium that can then lead to osteoporosis. Chronic liver disease, well, vitamin D in being activated from the skin, it goes through the liver and then the kidney in its activation process. So if you have chronic liver disease, you're not actually processing your vitamin D properly. So that's going to lead to poor absorption of calcium. Okay. Another one is high levels of intake of phosphorus. Okay. It tends to leach the bones. So very high consumption of carbonated beverages can also lead to osteoporosis. Okay. And the one that's not listed here is sedentary lifestyle. So if you're not using your bones, if you're not providing weight-bearing activities and exercises, the bones won't stay strong. Okay, so let's look at some interventions for osteoporosis. And actually, a lot of these are osteoporosis preventions as well, right? Even if you don't have the condition. So maintaining calcium and vitamin D in your diet, very important, right? Because calcium is what makes up the matrix of the bone, calcium phosphate. Limiting caffeine, yes, it leads to osteoporosis. Alcohol, another factor leading to osteoporosis, and carbonated drinks. So high consumption of carbonated drinks, all should be limited. The need for proper intake of proteins, magnesium. Vitamin K, you would think of, well, vitamin K is to make clotting factors so that your blood clots normally. But it's also needed for bone health, okay? It's needed for active osteoblast activity. So yes, I would think of vitamin K as really important for clotting factors when you're on warfarin. Say sometimes we have to reverse warfarin with vitamin K or Coumadin, but it's also for bone health. Okay, being out in the sun for 20 to 30 minutes is enough for your skin to synthesize cholecalciferol, okay, inactive vitamin D that gets fully activated in the kidneys. Encouraging weight-bearing activities and exercises for sure, right? If you don't use your bones, they get thinner and thinner and thinner, okay, leading to osteoporosis. The next ones are really just to avoid falling, right? So safety equipment in the house, such as bars for elderly people, avoiding slippery surfaces, clearing walkways. That's really just to avoid the fall. Because when someone with osteoporosis falls, typically something's going to break, right? The hip, the wrist, sometimes the femur, compression fractures of the back. Medications, we'll talk about some of them. So some of them that decrease bone resorption. Resorption means breakdown. So stopping bone breakdown. Stimulating bone formation is another group. Estrogen replacement. Estrogen definitely protects bone health, and that's why I'm gonna remind you over and over again. Postmenopausal women lose their estrogen because of lack of ovarian function. Estrogen deficiency leads to osteoporosis, especially in the first 5 years after menopause. Okay. Other medications, well, we mentioned calcium supplements and vitamin D supplements. Okay, and on the right, just some images. What has vitamin D in it? So mentioned eggs, cheese, some fish stew. So just take a look at what has vitamin D. What's rich in calcium? Well, the lower slide. Okay, so just have an idea of some common foods that are rich in calcium and rich in vitamin D. Okay, so just on this slide, if you want to skip it, no problem. I'm just going to do the questions at the back of the ATI book. So this is chapter 70. A nurse is admitting an adult client who has suspected osteoporosis. Which of the following findings are risk factors for osteoporosis? So history of consuming 1 glass of wine a day, that's not really a risk factor. So heavy alcohol consumption is a risk factor. 1 glass of wine a day would not be considered heavy alcohol consumption. It's kind of a sneaky answer though, because I mean, alcohol is a risk factor, but 1 glass isn't enough. Loss of height of 2 inches. It is it's an indication that there's osteoporosis. So is it a risk factor? Okay, I guess it is a risk factor, but it's also an indication the person already has osteoporosis, right? A body mass index of 18, so that's low, right? So that's basically just under normal. So that means the person has a light frame, and that's a risk factor for osteoporosis, since they're starting with an overall light frame as they go into their 40s, 50s, and 60s, so they're at risk for osteoporosis. Okay, kyphotic curvature of the upper thoracic spine. Well, that's an indication that they already have compression fractures of the thoracic spine. So it's telling us that, yep, there's osteoporosis here already. So is it a risk factor for developing it? It's a risk factor basically telling us that there's osteoporosis already. History of lactose intolerance, that's a malabsorption issue in the small intestine. So you can have malabsorption of calcium, minerals, vitamin D. So that would be a risk factor for sure. Okay, so the answer would be B, C, D, and E. Okay, A is not the answer only because they said 1 glass of wine. A nurse is providing care for a client who had a vertebroblasty of the thoracic spine. Which of the following actions should the nurse take? Apply heat to the puncture site. I'm going to tell you, usually you don't apply heat to a puncture site post-surgical. It's usually you're going to apply something cold, if anything, because of potential swelling. So now, what's a vertebroplasty? Well, it's where they've injected this hardening compound, almost like a cement, that is supposed to stabilize the compression fracture. I'm going to tell you, I don't think it's often done, but that's the procedure, done through an injection. So place the client in a supine position. Yes, you would do that and ask them not to move for an hour or two to let this compound harden. So B would be the answer. C, turn the client every 1 hour. No, that's going to move the spine potentially. Ambulate the client within the first hour post-procedure. No. Again, because you're going to potentially disrupt the cement that's been injected. A nurse is providing dietary teaching, this is number 3, about calcium-rich foods to a client who has osteoporosis. Which of the following foods should the nurse include in the instruction? So white bread really doesn't have any calcium. Apples, no calcium. And brown rice wouldn't have much either. Definitely kale would have the highest concentration of calcium amongst these for sure. Okay, next question. A nurse is performing health screenings at a health fair. Which of the following clients have a risk factor for osteoporosis? 40-year-old who has been taking prednisone for 4 months. Okay. A 30-year-old client who jogs 3 miles daily. Definitely not. So, by the way, yes, right? Anyone who's taking prednisone for 4 months is at risk for osteoporosis, right? So, any corticosteroid that someone's taking for a prolonged period of time is going to thin the bones. So, A is correct. B is not correct. That person's not at risk for osteoporosis. A 45-year-old client who takes phenytoin for seizures. So phenytoin is an anti-seizure medication, but one of its effects is that it can thin bones, mainly due to its effect on decreasing calcium absorption and also affecting calcium metabolism. So that's just something you're going to have to remember about phenytoin. Okay, so that one's correct. A 65-year-old who has a sedentary lifestyle, absolutely. Sedentary lifestyle, inactivity, the bones are going to thin because they're not being used, right? So that one's correct. A 7-year-old client who has smoked for 50 years. Smoking is definitely a risk factor for osteoporosis because you're impacting oxygenation of tissues, including the bones, right? So the bones are getting less nutrients, basically, less oxygen. Okay, so the answer here would be A, C, D, and E. Okay, last question here. Nurse is planning discharge teaching on home safety for an adult client who has osteoporosis. Which of the following information should the nurse include in the teaching? Remove throw rugs in walkways. Good idea, right? So adult client with osteoporosis, you don't want them to fall. Something's going to break. So remove throw rugs in walkways. It's just a perfect, throw rugs are just perfect to trip on, right? The tip of your foot just catches the throw rug and down you go. Use prescribed assistive devices, absolutely, to minimize any falls, right? Remove clutter from the environment. Okay, that makes sense because clutter you can trip on, right? So removing that is always a good idea. Okay, wear soft bottom shoes. Okay, I don't know why that would be information the nurse should provide in teaching, because soft bottom shoes are totally fine to wear. Okay, it's not going to impact osteoporosis. So I don't think that one should be correct. Maintain lighting of doorway areas. Sure. Yep. Maintain lighting so that they see where they're walking and they don't fall. Okay, so once you know the information, any question that's thrown at you, you can work yourself through it because that's basically what NCLEX is going to be, right? Okay, I know the information, so whatever question they throw at me, I'm going to be able to figure it out. Okay, well, let's go on.